pelvic floor dysfunction in men look like? That's the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. While men and women can have pelvic floor dysfunction, and it's more prevalent in women, not because of their gender, but because of the lifestyle and the different things that we get exposed to. Well, men get exposed to different conditions that are more unique to them. So putting that aside, what does that even look like in men? A lot of times people think, oh, it must feel or be different in men. While there are some symptoms and signs that are different in men, overall, the presentation has to do with the instability of the pelvis, which can be due to dysfunctional movements, habits, and lifestyles. This dysfunction can show up as lower back pain, can show up as sacroiliac joint pain, or pain in the back portion of the pelvis right here. It can show up as dysfunction in mobility with pain or without pain in the hips, knees, and ankles. Overall poor posture. That's something that exists regardless of the gender. In men, it can also present itself as pain in the scrotum, testicles, or penis. It seems to be typically more on the left side, but it does alternate from left to right. It doesn't have to be on the left or just on the right. And there is constipation that both genders can have regardless, but it seems to be a little bit more common in men. One thing that I see in my practice, because in the practice we are all about evaluating the stability of the pelvis and the posture and mobility of the major joints in the body, and maybe not so major joints in the body. But one thing that I see happening is a lot of times male individuals have engagement of the lower part of their glutes, where the gluteal fold is, where your butt cheeks get connected to the thigh, that fold there. There is an over engagement there, and that, in my opinion, comes most often as a result of working out incorrectly. So they're not in the optimal position in their body, and they're loading the joints that they're working out more. So that's a compensation that's taking place. So in men, obviously, there is pain in their external genitalia that is only unique to men: testicles, scrotum, and penis. And the rest is essentially the same. There may be a hypertrophy or enlargement of the prostate, but that's secondary to other things that's happening. So just wanted to bring to your attention the fact that male individuals do have pelvic floor, and there are most of their signs and symptoms are the same as the female counterparts. I hope this helped. Take care.